The blockade on food aid and medical supplies coming into Tigray has devastated many, and especially the more than 2 million displaced and in search of shelter across Tigray. More than half of these IDPs were targets of an ethnic cleansing campaign in Western Tigray that saw homes being destroyed, Tigrayans being targeted for arrests and torture, and many being loaded onto trucks and buses to be delivered to the banks of the Tekaze River. For more than a year now, these IDPs have been forced to depend on humanitarian assistance to help them get by, assistance that has been only trickling in over the past year. This is Desta Gabrechorkos, a farmer, was displaced from Tirkan in Western Tigray in November of 2020, along with his son Abel. Here in Idaga Hamus, him and his son have not received assistance in months.
I
took him to a nearby clinic, but he didn't get medication. They said it was caused due to lack of food. My son's body is itching. My body is itchy. I went to the clinic. They gave me insulin, but I haven't seen any improvements. In fact, my condition is getting worse.
Desta and Abel's story are typical in this IDP camp in Idaga Hamus, where many living in overcrowded facilities and unable to receive assistance have been exposed to illness.
We haven't received any assistance so far. My daughter's body itches. This is because of lack of food. I took her to a public hospital, but they didn't have medication, and I can't afford to take her to a private hospital. It's too expensive. There is also dermatitis on her head. It smells bad and it's bleeding. Look at her fingers. Her throat is also swollen. She can't swallow food without water. I took my daughter Arsema to multiple health centers, but there's no change. My throat is swollen. I can't communicate clearly. It's also very difficult to swallow food.
Brahana Teklahaimanut, IDP supervisor in Idaga Hamus, says that even in a small town like Idaga Hamus, there are thousands in search of shelter here, and many have had to go without much assistance over the past year.
We have around 6,000 IDPs here from different parts of Tigray and 500 from Afar. We haven't had aid reaching the IDPs here. Children have been denied education and remain in need of medical care, including survivors of sexual violence, and people with chronic illness have had to go without it.
The humanitarian truce declared in late March had many hopeful that those in dire need of assistance would be able to get it. But months later, only 20% of much needed aid has been able to reach Tigray, while vital services that could go a long way in relieving the humanitarian catastrophe, such as banking and communication, remain inaccessible.